Are we good? Good? Okay. All right, ready to start? Thank you to everyone for joining us for our largely virtual town hall today. There are a few people in the room. If you're online, you can see them. I think we have some of the members of the senior leadership here. We made a decision today to convert the meeting to a virtual town hall. And that'll be one of the subjects we're going to talk about today. If you're in virtual land, thank you for joining. We have really just 3 agenda items today. We've given a little more time to talk about the public health situation and the COVID virus. There are many questions about that, and we'll have lots of time to answer those questions. Anything we don't get to today, we'll send out messages, but that's a big part. We have some new staff that we want to acknowledge and recognize, and we have a presentation about the strategy for the School of Applied Health Sciences, which is very exciting, and really looking forward to that today. So I just wanted to preface with a few points, generally that I think highlight some of the major questions that we're receiving. We had a chance to read the Slido questions. It's live. You can go into Slido and ask your questions. The information is here. If you haven't used it before, it's very easy. You just go to slido.com and you just put in hashtag X967 and you can ask questions. There's already a lot of questions there, and we've prepared to answer many of those. I think what I'll do is I'll just start with some basic information for information sharing, and then I think we go to the new staff, Jacqueline, do we? And then we'll go to the strategic plan, and then we'll circle back and have a chance to answer questions. So obviously, everybody is very interested in paying a lot of attention to the public health situation now. It's a really important consideration for us, and it's also an important time for us to have clarity and in our communications, and we're trying to do that well. We welcome feedback about that, and we're every day adjusting and trying to improve that clarity. We also realize we're communicating to a very diverse group of people, and the needs of the frontline nurse and a teacher and a student may be all slightly different, so we're trying to find ways to communicate with everybody. The situation is evolving from day to day, and so that means there isn't one set of answers that are kind of fixed. We try to keep ahead of it. The communications team, Jacqueline Waldorf here at Michener and her team, and Jillian Howard at UHN are, I think, doing a terrific job to keep messaging. We do use a lot of the UHN messaging. It's customized to education and also to the Michener and St. Patrick campus, but we're trying to make it as consistent as possible. It just makes sense for us to have a similar policy everywhere as much as we can. Sometimes I think that means that there's nuances that we haven't thought of or we've missed, and we're happy to have any questions or feedback about that. And I think today, in this hour, we'll cover a lot of those details. A few simple things, and some of these in a way are things we should always be doing every day anyway, but it's just a good time to remind you. The first thing is that it's a requirement to wear or have your ID badge with you at all times. And this becomes important if you find yourself somewhere where there's an additional level of security or it's necessary to check your ID. I know we fall out of the habit, but if you could do that, please, if you could make sure you always have your ID, staff and students, with you for swipe entries and every other thing, but just in case we need to identify people, that's great. Wash your hands. The doctor and me, some of you know, of course, that I'm also Chief Medical Officer. The science is pretty clear. It's always good to wash your hands. I think there's some stress around the availability of hand sanitizer. I understand that, but the science is pretty clear. Washing your hands is far more effective. Soap and water. And the COVID virus is spread through droplets and surfaces, so good hygiene, and that's the very best thing you can do. And it's true of so many other conditions too, but we forget about that. So if there happens to be hand sanitizer, you want to augment with that, that's good, but it's not as good at and does not replace good hand hygiene. Masks. We get asked questions about masks. Masks are really important for healthcare professionals taking care of patients who have some kind of infection. They're not effective in any other situation. The evidence actually suggests that wearing a mask, if you're not familiar with using one properly, actually increases the risk because people fiddle with them and touch their face and actually do things that increase the risk. So there's no reason to be wearing a mask as a preventive measure. If someone is wearing a mask in our environment, I would ask you to ask them why they're wearing a mask, and if they're sick, they should go home. So nobody with any kind of sickness really should be at work. We're being a little more vigilant, and perhaps even a bit too vigilant. There's colds going around right now, for example, and some people are going to probably end up being at home nurturing their cold, but it's just a good thing for us to do, to check with each other and make sure we're well. And if someone is not well, they should be at home. The travel advisory we'll come back to. There's lots of discussion about travel. It's each day changes a little bit. The simple rules are there's no international travel for work of any kind at this point, and there's mechanisms to deal with that and adjust for it. I'll just share with you that last week I was supposed to be in Sweden for Wednesday, Thursday, Friday. I did the entire meeting online, all the regular sessions, all the teaching, other than the fact that I had to get up at 3 a.m. because that's morning in Sweden, and I had a kind of a jet lag without flying. It was very easy for me to do everything virtually. So think about that. If you can spare any trips internationally or domestically by virtual, that would be great. In terms of communication, I mentioned we're going to be messaging very regularly. We'll never totally be on top of it because it does evolve and change, but we'll try to do that as well as we can. The executive team here, we met for 3 hours this morning, and we're meeting every week, and we will be increasing that if we need to for regular communication, and we will message out our discussions. We're very interested in making sure we think about not canceling things, but continuity of things. So as an education institution, we have a lot of technologies available to us. Some of our programs are entirely online. There's big, huge parts of continuing education and our full-time programs that are entirely online. So we know how to do online. We have a lot of expertise. Lots of pieces can't be done that way, I know that, but there's many things we can do. So the philosophy that I'm taking and encouraging us all to take is, before you jump to canceling something, ask yourself if there's a good technology or a pedagogical method to allow us to continue doing it using virtual technologies. And we're really the leaders in this, and we're looking forward to continuing to push the edges of what can be done at a distance if we need to. So at the moment, we're proceeding with a large amount of our activities as we were. Many things are continuing. There may be some of them that get rescheduled or postponed or done in a different format. But again, I'd come back to the town hall today. Although there's enough people here, it doesn't feel totally odd. But it's like those pictures you see of the symphony orchestra playing in the hall with no audience. It's still music, it's still lovely, it's still nice to hear. There's really no reason we can't have a virtual town hall. In fact, none of us be here. I did one with Sweden where no one was in the room, and it was just a great meeting done over a particular technology that we have available to us. So that's my intro. That's not too bad. That was 11 minutes. I'll turn it over to Jacqueline, and then we'll do some of the other parts of the meeting. Okay?
Great. Thanks, Brian. So Christy is going to do some introductions about new staff.
Thank you, Jacqueline. And I think we have a slide. Do I need to click anything for that? Awesome. Amazing. Thank you. So we restarted this again at our last town hall in October. And what we did then was reflect on the new hires that had joined Michener as permanent staff members in that previous 6 months. And so now what we've done and what we'll continue to do as we proceed is to have this welcoming new people slide come up. And so these are the names of the individuals that have joined us in permanent roles since our last town hall. So since October, can't remember the date, 21st, I'm guessing. So we have these 5 individuals that are new permanent staff, and we have the category below, which we're calling now new permanent staff. And these are team members who had joined us previously on temporary contracts or maybe in another format and are now permanent staff to Michener. So we want to recognize those. Now, if you're at your desk, this would be the time I would ask you to stand up and introduce yourself. But I'm going to pivot a little bit on that and just take some time just to welcome everybody who's new to Michener in these roles. Thank you. And since these individuals are not here to stand up and wave to everybody, as you see them in the hallways, now that you know the names, please do connect and welcome them here. I also want to take note that we have a number of other individuals that we don't have listed because, again, these are the permanent staff members. But at Michener, we have contract roles and temporary staff positions, and we have a number of people that are coming in and joining Michener team. So to you, we say welcome as well, and we'll look forward to joining you in meetings as we move along. Thank you.
Thanks, Christy. So next, Fiona and Sydney are going to talk about the Hallmark Initiative as part of the strategic plan.
I promised them I would just say a very short introduction, not to steal their fire. I'm really excited about this. The strategic plan in education, Andrea Etherington's led us with the team, and the executive is very exciting and very ambitious. And one of the hallmarks is the expansion and development of the School of Applied Health Sciences. And this strategic plan piece has been led by Fiona Cherryman and Sydney Redpath, and it's pretty ambitious. It's very exciting. And so this is a first airing of it for all of you. The purpose of this short presentation is to get you excited about what's ahead, to get your enthusiasm. I think they're allowed to volunteer to help, right? Yes? And to stimulate questions and ideas that will allow us to go into really a whole new age for the School of Applied Health Sciences and the Michener Institute. So hand it over to you two. Rusty. You okay? Standing is good. It's healthy. Standing is healthy.
There you go. Thank you. Thank you, Brian, for that introduction. Very much appreciated. We are very excited and very grateful to be here today to share what we feel is a very exciting Hallmark initiative as part of the education strategy. And I'm just going to flip up the next slide, which actually shows all of the Hallmark initiatives that we have within the education portfolio. A little bit louder. I can hear myself echoing, so my apologies to those of you out there. And I can't actually ask you if you can hear me. I can ask you, but I can't hear your response. But I am getting some nods in the hallway, so hopefully this will do. So actually, as part of our Hallmark initiatives for the education strategy, we have 4, one of which is the School of Applied Health Sciences, which we hope to share our thoughts and ideas with you today. And we also have the Institute of for Education Research, or TIER, School of Continuing Education, and also the Teaching and Learning Ecosystem. So as I mentioned, we're going to focus today on the School of Applied Health Sciences. And the primary goal within this initiative is to deepen and expand the school through strategic partnerships and new programs and streams. But they're also aligned with UHN's education priorities, which are championing a culture of learning and teaching, driving the divergence of education, care, and research, and pushing the boundaries of healthcare education. So with that, I want to get into why are we doing this? Well, what's so exciting about this? And really, I think when we think back to our integration, when we went to integration in 2016, we were actually thinking about who should we partner with, why should we partner with them, and actually we ended up partnering with UHN, which was really exciting for us because we thought, and I hope they thought as well, that we could together achieve some really good things. So we think that now that we've had a chance to, borrowing from IPE, to learn from, with, and about each other, and having developed this education strategy, which is built on feedback from everyone who contributed to that strategy, and it took, 3 years, Andrea, in the making, and was put out last year, and now we're looking at acting on it. What can we actually do with that? And so the first thing is, we think that we can create a positive difference to healthcare, both locally, nationally, and also internationally. So we're expanding our horizons. We can go beyond the limitations of traditions and traditional colleges and universities. And a lot of that has to do with the fact that we are uniquely funded through the Ministry of Health versus the Ministry of Training Colleges and Universities, that we are an institute. We're not labeled a college and university. And how can we use that to our advantage? What can we do in terms of our number and range of programs? Well, now that we're affiliated with the University Health Network, there's so many opportunities. They themselves are are a very world-renowned institution with many different clinical programs and thoughts and ideas, and how can we help with education along that sphere. And again, finally, embracing a greater entrepreneurial spirit. How can we take market our uniqueness and put it out there and make it of value to others? So with that, we wanted to share with you the 5 ways that we think that we might be able to embrace and encourage this strategy. And we're going to start with Fiona, I think, for the next one.
Great. Thank you, Sydney. So we have, as Sydney says, 5 initiatives that we've identified. And so the first initiative that we've identified is around status appointments. So as many of you will know, we continue to encourage status appointments for our clinical teachers at our partner sites who are so critical to supporting the success of our students in their clinical placements. But we're actually looking through an academic model about really expanding that definition of status appointments so that we can include things such as program service. What happens if we have an expert in interventional radiography, for example, to get them to come and speak to our students? It's a great way for us to deepen our relationships across the clinical departments, but really enrich the student learning experience. We also hope that it will also contribute to professional development and growth of our faculty and really make us the organization of choice for our students.
The second area that we would like to work on as an organization is advanced degrees. So we already have a number of program areas such as chiropody, genetics, cytology, and cardiovascular perfusion, which require an undergraduate degree for entry into the actual program. And so in terms of these professions, we really feel that they warrant higher recognition and at a level that actually speaks to what they contribute to the healthcare system. And so we're actually looking at possible master's degrees for these programs. How will we do that? We're looking at a couple of different ways. We have traditionally used partnerships. So if you look at the MRS programs where we offer both a degree and a diploma, we are partnered with the University of Toronto for the radiation therapy, or MRS programs, and then for Laurentian University for the radiation therapy program. But we're also looking at a process which some of you may be familiar with already called PCAB, which is the Post-Secondary Education Quality Assurance Board, which allows institutions other than universities to grant degrees. And so we're also looking at that possibility for granting a master's degrees in these programs, at least to start.
No, thank you. We're doing the dance here, everybody. You're just so lucky you're not in the room. So the next one that we're looking at is our pan-Canadian focus. And so for many of our programs, and especially the 4 programs that Sydney already mentioned, the diagnostic cytology, the genetics technology, the cardiovascular perfusion, and also chiropody and foot care to a certain degree, we really have a pan-Canadian focus as a specialized organization and post-secondary. So we're really thinking, how can we plan to become a national resource across Canada for specialized health human resource planning? So how can we work with different provinces so we can identify where their specific needs may be and how we can support across the country? So we're really looking now to go and speak with and collaborate with provinces at a provincial level. What are your needs for HHR planning in these specialized areas, and how can Michener help be a solution provider beyond Ontario?
So those are the programs that we already have in situ and things that we can do to enhance those programs and market their value. But we're also looking for opportunities around new programs and streams. This past year, we have approved and have launched the fellowship in chiropody, which we're very excited about. And we're looking and hoping to launch a number of unique programs in many domains across the healthcare field. We're looking at streamlining the approval process that we have in situ right now to expand across education, across UHN, and also to hopefully introduce a couple of new programs at least annually.
And then as our fifth initiative, we're really looking at what we're sort of classifying at this point as our new Michener competencies. Many of our programs within the School of Applied Health Sciences are at that entry-level practitioner perspective. So we have competency profiles that are for entry-level practitioners. And yet when we talk to employers, they're often frustrated. How are we not dealing with preparing people for the future, artificial intelligence, robotics? How are we looking to meet those niche needs of different communities and employers? So we're thinking about, well, we do this really well around supporting the elderly, around our working with seniors curriculum, around our IHI quality improvement modules for our students, really getting people to be able to do improvements as frontline workers. Whether we could expand this to include different areas. So we talked about artificial intelligence, robotics, things like mental health first aid. We know that that's becoming so important to both our student population, but to the workforce in general. What about actually doing something so that our students are well prepared to deliver culturally safe care for Indigenous, I can't say it, for Indigenous peoples? I'm sure there are many more ideas, and this is just the beginning of conversations we hope to have with the community about how we can engage your voices in this strategy. And so how are we going to take this forward as our next steps? So this has been a little bit of our roadmap to date. What we have done, we've been meeting with Dr. Hyvie Weingarten, who's an executive in residence here across UHN at this time, and he's been really informative to helping us prepare and be future thinking about how we can really, we provide excellence in education, and the students that we send out to the workforce are valued members of healthcare delivery, and we need more of that. How can we really embed the system and enrich it? Because what we do is actually very good, and so how can we do more of it? We've obviously had some discussions with the academic chairs, at the registrar's office, many of the key areas in the academic portfolios at Michener. Does this resonate? Do you think that when you go out to career fairs that this would excite future applicants? Is this manageable? Is this reasonable? The education executive, thank you very much for all your valued feedback from across the system. It's been really helpful. We've also talked to our faculty here, their OPSU leadership. Is this exciting to faculty? Yes, it is. So how can we get people involved? So we're here today talking at the Michener Town Hall to help engage people, hopefully excite you as well. And then we're going to begin broad consultations. So we really think that probably the next steps are for interested people to reach out to Sydney and I, and we can have exciting conversations going forward. Thank you very much for everyone's time.
Thank you.
Thank you both very much. You can see it's a very ambitious plan. We're starting to say Michener is Canada's School of Health Sciences, and you can see why. And so thank you both very much. And I would echo their invitation again to contribute to this. So if pieces of this are particularly exciting to you, reach out to these two and to all of us to help us take it forward. Now we're turning to our question and answer Slido period, right? Should I sit or stand? Yeah.
Sorry about that. Thank you, Fiona and Sydney. And actually, does anybody in the room have any questions that anybody would want to share at this point? Nope? Okay. So we have a lot of questions. they seem to be grouped in kind of 3 general areas around the COVID virus, around HR, around facilities, and space. Tend to be the 3 major groupings. So I think hopefully Brian's answered a lot of those already, but I think I'm just going to try to group the answers that way, and maybe we'll start with COVID answers and then try to just focus on the ones that we haven't answered yet. So first one. So if we're canceling in-person town halls and meetings because of COVID-19, why are we still teaching/working? These are still risky gatherings.
Don't forget, team, to wave at me when we've decided you're going to help with the answer. Was I starting this one? Yes. I am, yes, says Fiona. Okay, so great question. And it goes right to the heart of the evolution of events. So we today didn't cancel the town hall. In fact, there was nothing to prohibit us from having a full town hall. UHN and Michener haven't yet adopted any policy of ending large gatherings, but I thought it would be very valuable in consultation with my colleagues to try to do it virtually. So there'll be a lot of this where, as I said earlier, we practice with how to do well virtual things, and a town hall is an obvious one. It's easy to do a town hall virtually. There are going to be, I suspect, certain restrictions, but we don't want to get ahead of ourselves. We want to follow them as they're sensible. We do have a responsibility to our students to deliver their education and whether that's continuing education or full-time. So we want to make policies and have regulations that are sensible. At the moment, in the university environment, in the Michener environment, there are no cases of the COVID virus. And we are currently watching that very carefully. And when and if there's an increased risk in some area, we may alter our getting together or policy or our activities. But currently, we haven't done it yet. There is a group, and maybe Fiona, I'll ask you to just say something about the contingency planning or the planning for the School of Applied Health Sciences and how that will sequence and how decisions will get made about if we're altering anything in terms of classes or our structure.
Thank you, Brian. Yes, I think it's really important for everybody to recognize that we as an executive, an education executive, are really monitoring the situation very closely and in close collaboration with our UHN colleagues and IPAC. Mandy Lowe, my colleague, is the COVID-19 expert for the clinical learners, and I'm the contact for our Michener site as well. So if people have questions on site about COVID-19 and our response and preparedness, be happy to take those questions and concerns, and Mandy would be able to help with our clinical campus across UHN. As far as classes go, we're continuing to offer our classes, and we have contingency plans in place where we have a great faculty group who have been well organized about utilizing Blackboard very efficiently, and that many have already a lot of their plenary classes that are voice over PowerPoint, so that if there is illness or weather closures, that people can continue. So we already have certain contingency plans that are in place, and we really thank and congratulate the faculty for being so proactive on that. As far as one of our great strengths when as part of our outreach, as part of our strategy actually, has been people have really valued Michener's experiential learning. And the labs are much more challenging for us to offer in a distance format or an alternative format. So we continue to think about that and sourcing videos that are not replacement by any stretch, but also do help from an observational perspective of some of the important skills and tasks that our learners need to be able to attain. We are continuing to look at what we can do, and whether, if there was ever to be a closure, whether that would be temporary in nature and we could, for example, put our plenary sessions ahead so that when we are back on site, we can maximize the time we are here, or whether we can change our schedule. We know from the college, the Ontario College strike, very unfortunate situation, but there was a closure of colleges, Ontario colleges, for 5 weeks. Those students still graduated and met their certification exams. So we're kind of looking at historical data to inform our next measures as well.
Thank you. No,
It's okay. Actually,
excellent.
Fiona, before you sit down,
Come back.
we did have a question about whether our Laurentian or joint program students are affected as well. So I don't know if you can address that.
I would love to answer that, thank you. So, as we've said, everything is evolving remarkably speedily. And just over an hour ago, we found out that Laurentian University in Sudbury has actually issued a closure effective 12 o'clock today. So they're moving their classes online. We do obviously have students based at Laurentian University in our radiation therapy program. We offer our classes in a distance format, no problem whatsoever, but we do have labs that are held on site at the Laurentian campus and also at Health Sciences North. At this time, I'm recommending that we cancel tonight's lab that is scheduled at Health Sciences North so that we can talk without so much pressure with our colleagues, and so that we can collaboratively decide what the next steps are. At this point, we have not had any clinical sites say that they are not accepting students, and so we continue to monitor that very closely as well.
Thank you. Okay, so again, related, there's been a couple of questions about it's useful to have information from UHN perspective, but what can we offer from a learner perspective? To a degree, I think I can sort of address that. To a degree, we've been trying to just customize the consistent messaging with the contacts and the specific information that people need. I think as we continue to learn, we can do that better, and we do have a pandemic plan that's being revised and will give us some direction as well. So that's fluid as the situation continues, but we definitely hear that comment. So now there's sort of some specific medical questions. I think, Brian, you've handled the mask fit issues, masks generally not needed here. That's not really an issue. There's a question: when should we start self-isolating? If we start to feel the symptoms of COVID-19, or only when we are tested and confirmed that we have it?
That's a great question. So yeah, fortunately, I'm learning quickly on both sides, and in my other role as Chief Medical Officer, I'm regularly in touch every day with our IPAC, Infection Prevention and Control team. Dr. Susie Hota, who's famous, she's on TV all the time, is a wonderful resource to us. So I'll do my best, remembering I'm a psychiatrist and not an infectious disease expert. Okay, so the first part of that question is about if I have symptoms. And I touched on this earlier. So if anyone has any illness of any kind, but particularly respiratory illness symptoms, you should contact occupational health. And occupational health goes through a screen to ask you, and triages essentially, the staff in occupational health very well trained to help you decide what to do if you have symptoms. And out there in the healthcare system, this is evolving a little bit. And it's very likely, I think, in the next few days, we'll have a COVID screening center for efficient screening and testing. We don't have that just yet, so we're using our emergency departments. They are discouraging, the Ontario government and Public Health Ontario is discouraging people from going to a hospital when they have symptoms and suggesting that you call your healthcare practitioner, hopefully you have one, and then get advice that way, because there are other ways. So, but if you have any kind of illness or symptoms at this point, you should contact occupational health and do that from home. Don't come into the hospital or the school and do that. Now, there are increasingly people that have been asked to either self-isolate or self-quarantine. And let me explain the difference between those two. Mandy Lowe helpfully circulated this definition today. And so, for example, There are several people that I'm aware of now in the hospital that are sick with something that's probably a cold. And it's always good practice to stay at home when you're sick, but they've been asked to self-isolate because they're sick, to stay away from self-quarantine. No, if they're sick? They're sick, self-isolate. So if they're already sick with something, they're asked to isolate themselves from other people. So they go into a self-isolation process. Now, there's a high vigilance for COVID now, so that means they're probably having a test done, and then the results of the test. If it's negative, they'll stay at home until they're well, and they'll come back to work. That's the normal sick policy. But there is a new phenomenon. It's a little bit different, and it's a public health activity where people would be asked to self-quarantine and at the same time self-monitor. And those activities are done if there's a sense of a potential exposure. So, for example, you've flown on an airplane where there was a case, you were in aisle, row 23D, and public health calls you because the person in 23F tested positive. They will then ask you to do a self-quarantine and at that same time self-monitor. So if you begin to develop any symptoms, to call public health. If you never do, in 14 days you're clear and you go back to your normal situation. So I think, have I answered the question about the various variations? And I don't think that will change through the course of this.
Thank you. So I will put this one out there, even though I think we've kind of answered it, but there are some restrictions on gatherings that are starting to happen, and there's a specific question about wavelengths, which is an upcoming event, and
Maybe I'll ask,
other events that are planned.
I'm going to ask Maria to start with this, which is just to speak about the idea that we have, in addition, we've heard lots about the School of Applied Health Sciences full-time programs. We'll have some decisions to make about other kinds of courses, and so maybe, Maria, you could start us on that?
I think it's a pretty quick answer in that we're just proceeding as planned for now, and things can change as the situation changes. So we're continuing to honor our bookings in terms of external bookings, welcoming external guests into our continuing education program, save international learners, of course. But for now, it's just proceed as planned, unless we need to shift our strategy.
That's great. Thank you, Maria. Yeah.
So I think that's most of the COVID questions. If there are others that have come through from people who have sent them into Slido that we have not addressed, if you just want to send another Slido note saying COVID urgent or something, then I'll know to go back and we'll try to address that one.
Yes. And we can answer questions after the meeting. Anything that's on Slido that we don't get to,
Absolutely.
Don't worry, we'll answer the questions, we'll send them out.
Okay. But there was one prompt to remind people to cough into your elbow.
Oh, yes,
But
that's
not your
true.
hand.
Mm-hmm.
Okay. Right. So somewhat related, I'm just going to move over to the space issue. There was a question about, I'm sorry, I have to scroll through here. What is facilities doing to mitigate potential spread of COVID-19? So Paul's here to answer.
Paul.
Hi. So we've had a lot of requests about cleaning as related to COVID-19. So we are in consultations now with our cleaning contractor to do some enhanced cleaning and disinfecting on surfaces. This would primarily be focused in public areas. This would involve using harsher disinfecting chemicals than we typically use and on a slightly more frequent basis. We want to make sure that anything we do is going to work and it's good value, so we have a few more conversations about that, but we'll likely roll something up with that fairly soon. But it's also important to understand that we are currently been advised by the supplier that we can no longer purchase hand sanitizer, and we expect some other cleaning supply issues to come up over the next few months, as the government has instructed them to only sell them to hospitals and acute care sites in order to ration the supply. We still have some, but it will likely run out. And this, I think, goes back to what Brian said about hand washing, and we'll be putting some additional signage in bathrooms to regarding to with proper hand washing technique.
So since you're up here, we'll touch on some of the other space questions. One question said, external inquiries to book our space increased. We're ignoring that we're a school and academic priorities should come first before UHN. How are we prioritizing space?
So generally speaking, maybe with a very, very rare exception, no academic event would ever be changed for an external booking. Academic events are scheduled as part of our scheduling cycle. We actually, when my group goes out and book spaces, or CASE goes out and book spaces, we're not even allowed to sign the booking agreements until the academic schedule has already been generated. It does happen on occasion, but I think the impact of that is quite low. Having said that, I think we're all very aware that the number of events has increased, and myself and other members of the leadership team have been working on looking at a new strategy of how we manage this increased interest in our space, and making sure we're balancing it with the academic activities. I don't know if, Maria, you wanted to, no.
And then related to that, what are we doing about classroom space? Larger classrooms are in need, but there's not enough of them to accommodate all of our classes and programs.
So I pretty routinely report to the leadership on our space, and we do this using standard metrics that are used and to measure ourselves across other educational institutions in the province. Based on our current sort of curriculum metrics, so FTE and hours we spend in labs, we're probably a little bit oversupplied on the whole in space. There are certain areas, particularly large classrooms, where they're in a shorter supply, but they still meet the requirements of our academic programs as they exist today. That's sort of the key point, is that with all of the conversations around growth, obviously we have to balance that growth with the space that we have. Not just the classroom space, but the space for all the different types of space categories, student lounge space and, office space, and so on. So I would say that we have to be very careful as we move forward and certainly focus our growth into certain space categories, but that today we meet the needs of the current academic programs.
Thank you. Okay, so it wouldn't be a town hall without some tough HR questions.
Mm-hmm.
So, Christy, if you wouldn't mind coming up, I'm going to throw some of these in your direction.
Don't throw them.
Throw them my way. Give me a lob.
Gently transition them over.
Sure.
Okay, so for non-union support staff, are there
Yeah.
any work from home options? Are we, full-time and part-time at 222 St. Patrick, covered by the UHN working remotely policy?
Right, and so the short answer is yes, there are work from home options, but no, we're not covered by the policy. So I'll dive into that a little bit. That policy was brought about at UHN in response to the employee engagement survey, where there wasn't language before that spoke to those arrangements. Michener's culture is very different. We've always enabled those opportunities where it makes sense, and there's no reason for us to embed something in policy where it's naturally our culture to do so. Okay, so that's the stance we take there. So that being said, the opportunity to work from home is a benefit to employees. Right? It's not a right, but it's a benefit. And for us to consider when and where that makes sense, we need to take things into account, such as what are the tasks that are involved. There's obviously, you can name a number of hospital jobs where it's just not feasible for them to be done from home. It's very similar here to Michener. Aside from the type of work that we're doing, how often are we looking to have this opportunity to be at home? Is this an ad hoc when it makes sense, when things come up, or is this a regular occurrence? So these are the things we need to consider. What are the deliverables, and how would we make sure that people can still attend? We have this, live town hall option. What can we do to meetings without incurring additional costs that would allow us to facilitate somebody working from home and yet still participating on the team? And I think there's a lot to be said about Michener's culture being a team-based and collaborative approach. So how do we make sure that we don't lose that in those situations? And then finally, the ultimate response is that without having a policy, employees are encouraged to have those conversations with their managers. So sit down, it's a discretionary approach to see what works. We can pilot them, we can have those conversations on how often it happens, again, taking into consideration the frequency, the type of work we're looking to do, as well as how many other people at the same time are looking for that approach. So it's really a decision that would rest between the manager and then in consideration of the team needs. I hope that covers most of it. If there's questions that don't get answered through those conversations, come and chat with us in HR, because we do have the opportunity to walk through some of those premises that we'd want to make sure we're considering when we're moving forward.
Great. So don't go away yet,
Okay.
but I might actually ask Brian if you want to comment just on some of the discussion that we had earlier about making sure people are technologically enabled
Yeah.
to work remotely given the virus.
Sure.
Yeah.
Thanks, Christy. That's great. And it's critical. And, you point out in UHN, there's very little work from home, in fact, because so much of it is frontline and needs to be done that way. But so in this situation, there may be some nuances and opportunities related to the COVID situation. And so, for example, we had a meeting of the medical staff last evening, the leadership. Obviously, the vast majority of medical staff needs to be in the hospital. But there are partial activities or preparatory things that can be done, both in the case of working from home, but in the case of self-quarantine or self-monitoring. So if somebody is asked by the organization to stay at home, that's a different scenario. So what I've suggested is that especially managers and leaders, but really everybody, run through in their mind, if you were needed to do your job from home, could you do it? And it might mean modifications, to your point, in discussion with your manager, obviously. And it might be that we readjust and reassign work in different categories according to what the team is able to do to meet the needs of the job. But it's a good preparatory exercise. I've asked all the physicians in the UHN and everyone to start thinking this way. Is your home set up for this? Do you have the technologies available to do it? Are you able to connect easily? Do you have the call-ins and the right numbers? On the hospital side, and this is less relevant here, but can you access the electronic patient record, for example? So those are just steps worth going through. And it's, of course, a great time for us all to learn how to use virtual tools in case we need them.
Thank you. Okay, so there seems to be a lack of availability and transparency around our HR staff.
Yeah.
With potential increases in HR demand coming, what's the plan to resolve/improve?
Sure. I think there's three sort of questions that relate to
Yes,
HR
okay,
service
yeah.
levels. So I'm probably going to try and cover the scope of those three in this one response. Otherwise, I'll probably be repeating myself a number of times. The question of availability, that might be directed at me. Personally, I have a number of different clients, so I'm often off-site. I'm not sure about the transparency piece, but when we're available, much like the working remote theory, just because we're not on site doesn't mean that we're not available. So I want to make sure that I'm clear on what that request is. When it comes to the question of availability as well, I understand that at Michener, there was a previous staffing model for human resources where there was 2 dedicated people who were on site all of the time, and that is different to how things are staffed at this time. And so we are a little bit more expected to be in other places or at Toronto General attending meetings. I know our colleagues that held the HR roles before us even had a coffee machine in their offices to encourage those staff members who want to come by and have those conversations. While I don't have a coffee machine, I absolutely encourage staff to come and meet with us, and our calendars are available through the scheduling assistant, so if there's times that you want to meet with us, please know that you can. I have a feeling that that question relates more to some of the other questions in regards to the service levels. So if you're okay with that, Jacqueline, I want to make sure I cover those off as well. So a lot of the initiatives that we have in our team tend to take us away from work. As far as being at our desks, and yet at the same time, we're also addressing projects and initiatives that are working towards the betterment of Michener as a whole. So sometimes it's that behind-the-scenes piece that you're not seeing, that we're working towards projects that we'll be able to roll out. That being said, the question related to the turnaround time for forms or responses, I absolutely agree with you. So whoever brought that up, thank you. I absolutely agree that it should not take repeated requests to get you the information that you need to do your job, and we want to make sure that we support you on that. We have instituted a couple of measures to help address that piece. So things that we have done, and we have a new locked drop box on the 5th floor. So if you're coming by with forms and our desks are closed and our doors are shut, there's a drop box there where you can put your information in, whether it's a form or a document that we'll be able to collect. So you're not required to wait until somebody's on site for you to do so. Another thing that we're looking at is our systems piece. We have a very antiquated system for our HR database, and we're working the best we can with it. At the same time, we're looking for opportunities to use that or other facets that will allow us to enable employee self-service methods. The updated VIP system, as just one example, at UHN, has a feature that allows staff to go in and create their own confirmation of employment letters. Right, and that's the way that HR systems are going, so that there's not as much needed for an HR administrator to have to punch things out when employees can just get that information when they need it. So when we're looking at updating our systems, those are the sorts of things that we're putting in the back of our minds, and to how do we not just make it easier for us to do our job, but how do we make it a better user experience for all staff. Other points I just want to make is that we've actually added, for the last year, we've had an HR intern on site, which helps us a little bit with the workload component. We're a learning institution, and so it's a great opportunity for us to bring somebody on board who is looking to engage in different projects, and yes, help us with some of that administration as well. With that, we make sure that we allow the intern to work on projects that are of value, because we want to make sure that they have a valuable experience as they move out into their next steps in their career. But that's somebody additional on site who allows us to help answer quick questions, respond to emails, work on great projects, those sorts of things. There was a question, I don't believe it's on the slide there, that talks about grievances and diversity events. We have, I'm happy to say here at Michener that our culture is one where we don't have grievances, not often anyway, but we do have a timeline that's built in specifically within the collective agreement that we would adhere to if grievances do come up. So we'd be bound to meet those timelines. And the piece about diversity events, unfortunately, I'm not actually sure what specifically that's referring to. And just sort of to cap off this long-winded answer I'm providing, is that we want to be able to respond to the specific instances that you are having as pain points. So if you're seeing things that you're not getting, as much as we want to be able to talk to them at a town hall, we would much rather we sit down and walk through where those are so that we can integrate them into our plan moving forward. We are looking at ways of seeking that feedback, so whether that comes as a survey about the HR service levels, we want to know specifically what those pain points are so that we know how to properly address them. So when you see that request for feedback, don't be shy, and please do respond and let us know what we can do better, or where you've seen improvements and some ideas that you might have. I think that covers most of those three.
There is one more question,
Okay.
but I will make a comment. One of the programs that HR has offered is the
Yeah.
respect and civility training, which
Oh.
has been really great. And I would just remind people that learning should apply to all forms of communication. So the other question that you may be able to answer is, there was a comment, it's unfair to employees with children impacted by TDSB strikes that have been told to use their personal and vacation days. This seems unfair. Where's the support for this?
Yeah, what I'll talk about there is, and I'm not going to limit it to TDSB, right? The educational strike piece is not limited to TDSB, and nor is it limited to other things that are going on, whether it's COVID related, if your student gets sick, whatever that looks like. The way I read the question really was, what sort of supports do we have in place to help people who have work-life balance concerns? And so that's the way I'm going to respond to it. And if someone's looking for something more specific, be sure to write in and let us know. So the supports that we have, again, going back to Michener's culture, is we have personal days and vacation days are actually essential for staff to use towards uninterrupted time away from work to deal with childcare, elder care, personal matters. So in essence, that's specifically what they're there and meant to be used for, whether it's a TDSB strike, or somebody at home who needs your time. So with that being said, I want to make sure that aside from personal days and vacation days, that you're aware of other policies and practices that we have in place. We talked a little bit about the working remotely opportunities. That might be something that helps suit that situation that you're having. Another piece, we have the Summer Flex Time program at Michener that we've brought on, right? And that allows for people to shift their schedules in a manner throughout the summer months that allows for one day off after sort of a 2-week period. So where you build up that time so that you can take a day off. And some people really utilize that in order to help manage some of their work-life balance questions. Another one we have is governed through the the Employment Standards Act. There's other leaves that are available. So staff who unfortunately are in situations where they're dealing with a critically ill family member, there are specific leaves built into that act that we would abide by and help walk you through to understand what your specific situation looks like. And then finally, because it wouldn't be an HR presentation without me bringing it up, I have to remind you of the Employee Assistance Plan. And so that is Michener's ComPsych program. The access to it is available through My Michener, and that provides free counseling for personal situations, finance situations. They actually do offer opportunities for childcare and elder care resources and references and referrals. So again, I always make sure I have to add that into the conversation because it's an important one to have. So if any of these situations ring true to you, please come meet with us so that we can walk through and understand as much as you're willing to share with us. We can help address your specific situation and look to provide you with tools to go have those conversations and put something in place.
Thank you. So we're getting very close to being at the end of our time. I'll remind everyone that we will answer all of these questions and send around the answers with a link to the recording. After the fact, so your question will get answered, but do we have time for one more? Do you want to wrap up?
Am I good?
You're done.
Sorry, you're done. Yes, thank you so much, Christy. Okay, so the next one, just in order of how many thumbs up. How is it that we at Michener Institute keep hearing about UHN's deficits when we are clearly not UHN employees? No ID, separate payroll. Please explain the budget's correlation.
Right, a super important question. We said, who was going to start? I know, Garth, you were going to add. Fiona was going to start, Garth would add, and then I'll tail.
And I thought I'd escaped. Well, I think when we've had this question come up previously, I've really answered it by saying that the UHN landscape really does represent the public landscape in Ontario that we are intricately involved in. It also gives us insight into the type of financial pressures that our students are being placed in their clinical placements as well. It also is, although our funding is separate and we're in good shape, thank you to everyone who's a really great budget manager for making that possible. It is something that we have to be cognizant of with our transfer payment agreement from the Ministry of Health. It's the same ministry. It hasn't increased for the last 3 years. And so we are trying to do actually typically more with stable funding that is not growing. So it's really important for us to be cognizant of that.
Thanks, Fiona. Just to add to that, like UHN, we have a transfer payment agreement. That is different than the other book of business that we have. And within that envelope of the transfer payment agreement, we are faced with pressures. We have had funding cuts as UHN has. And so we are impacted by the same environments that impact in UHN. And historically, we have been using other Michener-generated revenues in order to fund the transfer payment programs that the ministry has been helping us with. And so in that context, it's prudent for us to continue to follow the guidelines that UHN has been implementing.
That's great. Yeah, thank you. Yeah.
We're good?
I think we're good.
There's one last question we can take.
one
That's a
last
really quick
question.
one, I think, is, where is it? Do you know when we'll change our name to the School of Applied Health Sciences?
That
From a
question
working
is for you.
Yeah, well, it's Sydney can contribute to
Sydney,
this as well.
when
but-
will we change our name? What is our name?
Our name is, and will continue to be, the Michener Institute of Education at University Health Network. So I think there's been some confusion possibly because of our 4 hallmark initiatives where we're talking about the School of CE, the School of Applied Health Sciences, but those are really just entities within. Michener Institute of Education at UHN is our umbrella organization and will remain so.
And that will be reflected in the marketing materials that we're producing. Right.
I think we've reached the end.
Yes, thank you very much.
Can I thank Jacqueline for doing a terrific facilitating job? We would like feedback on this format in general. We're trying to do these as often as we can, answer your questions. So maybe let us know about your experience of doing this from a virtual vantage point. And thank you for participating, and we look forward to the next one. Have a good day, everybody.